Hi, I'm Michelle. I'm a therapeutic massage therapist with the Vital Fitness Holistic Center, and we brought Vital Harmony Therapeutic Massage and Accelerated Fitness together. And I wanted to talk to you today a little bit about just getting the neck and the spine into the opposite position of the constant sitting. We want to make sure that your psoas muscle is going to be able to expand, which goes from here to here and helps you take that extra deep breath. So what we're going to do is we're going to do just 4 poses to kind of quickly get you through in a good variety of poses in a nice, even way to be able to stretch yourself out. You can do these several times through the day. Take your time through them. You could probably get this done within less than 10 minutes and do 2 sets. So first we're going to start with a deep breathing technique. You're going to fold your fingers underneath. You're going to tuck in your sacrum, your lower spine. Lift your elbows up. Take a deep inhale. Chin back, chin to the ceiling. You're exhaling as your arms go in. Then you inhale again. When you do that, the most important thing is the head tilted back, the spine straight, chin up. You want to compress this area of the spine to be able to open up that fluid. So you can be doing this as I'm talking to you to help you do a couple more. So you're going to say elbows up, breathe in, chin up to the ceiling, head back, tuck in your sacrum, pull in your elbows, suck in your stomach, take that big deep breath as you come down. You should do this at least 5 or 6 times. Once you're done with this, you're going to take your fingers up. You're going to fold your fingers like this. Go straight up. You want your forearms to be as close together as you can. You want your biceps to be behind your ears. You want to lift straight up like a string is taking you to the ceiling with your heels close together. Again, your sacrum, your lower spine is tucked in. And you want to put your weight into the opposite foot of where you're leaning. Lift your fingers up again. This is not about folding to the side. This is about getting your spine up and out. Lift your fingers again. Push that opposite heel into the floor. Go straight up again. And you're going to look up at the ceiling, the same exact movement as before with your neck. Chin to the ceiling, head back. Lower spine tucked in and under. You're going to bring your belly button to your spine and you're going to try to draw your biceps to your ears. Now you're going to come forward. Again, it's not the bend back, it's the lifting up. So lift up and out, keep a straight spine, come forward. This is basically a modified Bikram because we're doing it so quickly. You're taking your time. So bend your knees when you need to, anything you need to keep your spine straight. We aren't going through the full movements of Bikram. You want to keep your knees together. Bring your head down. Try to straighten out your knees. The idea is to get your body folded down onto your legs. When you come back up out of this position, arms straight, you're going to protect your spine. Spine straight, knees can be bent. Go straight up. Again, the arms are going up and out. You're looking straight ahead of you the whole time you're coming back up and the whole time that you go down. You can do that a couple times as well. You're going to notice the difference in the improvement. After that, we're going to go down to the floor. We're going to do cobra pose. Most of what we're doing is we're trying to bend that spine backwards, opposite of sitting all day. We're trying to undo the sitting. So as we come down, fingertips right underneath. Turn this side a little bit here. Fingertips just underneath your shoulders. Point your toes. Squeeze your heels in. Squeeze your knees in. You're going to look up at the ceiling. Your chin is going to go up. You're going to go look up through your eyebrows. Have that spine, the cervical spine, compressed. Squeezing your heels and pushing your shoelaces into the ground. Come back down. You're going to feel that right in here and right in the neck. At this point, just lay down and take a break. You go ahead and feel the fluid going through. One of the biggest things that you want to feel is that fluid going through. The next one we're going to move along to, you can do this in 2 different ways. You can do 1 at a time if you have trouble reaching your feet, or you can do 2 at a time. If you do 1 at a time, you're going to have your arm out in front of you, your opposite arm out in front of you. You're going to have the other one on the shoelaces of your foot. You're going to lift your front arm, push your foot with the shoelaces back to the back wall, and hold your knees together as tight as you can. The idea is to get the thigh off the ground. And again, we're going to be compressing the cervical spine back, looking up through our eyebrows, and come back down. If you can do both, if you do it a couple times a day within the 3rd day, you may be able to do both and graduate to that. Keep your knees as close together, hands on the shoelaces of the feet, push. You're going to lead with the legs and the foot pushing into your hand, not with your shoulders. So you shouldn't be lifting up this way. You're not going to be getting that compression properly. If you watch, you can see my feet push and you'll see my legs elevate. Then the head comes up. And then again, just lay down flat. Take a good 30 seconds, 45 seconds to lay flat afterwards. The importance of that is actually allowing your body to get the fluid to move through. When the fluid moves through, you're helping to keep the inflammation out of the body, you're clearing toxins out of the body, and you're allowing your organs as well as your muscles and your nervous system to start functioning better. If you have any questions, we will have information on the bottom of this video so that you can reach out to us. Have a great day.